my name is Alyssa Scher, and I'm going to be doing my PSA on the STD called syphilis. So what exactly is syphilis? Syphilis is a sexually transmitted disease caused by the bacteria called Treponema pallidum. It is generally transmitted through infected genital ulcers, and these ulcers also aid HIV sexual transmission. Local statistics in Louisiana. In 2012, there were 41 parishes out of the 64 parishes in Louisiana that people were diagnosed with syphilis. 3 of the parishes had more than 20 cases. Those parishes included East Baton Rouge, Caddo, Shreveport, and New Orleans. In addition, African Americans with syphilis were the highest in all regions. When it comes to gender, Caddo Parish had the highest syphilis rate with both males and females in 2012. Also, during the past 10 years, syphilis has surpassed the national rate in Louisiana. From the year of 2006 to 2011, Louisiana actually had the topmost syphilis rate in the nation. However, the rate eventually decreased by 25% from 9.9 per 100,000 to 7.4 per 1,000 people. This put Louisiana down to 3 in the nation instead of the top, again in 2012. Additionally, the highest age range of syphilis was 20 to 24-year-old men. After that, it was 25 to 29. Here are the stats on Louisiana. In 2012, there were 127 females with syphilis that were noted, male 212. African American was 289, Hispanic 5, and 43 for white. And the age group, as you can see, from 9 to 14 years of age were 0. The highest was between, like I said, 20 to 24 with 101 persons. And the next highest, like I said, 25 to 29. And then ages 45 plus was 30 in 2012. Now, nationwide, among the 50 states, the highest rates of syphilis occur in Louisiana, Maryland, Georgia, Illinois, and Florida. Also, reported cases to the CDC of syphilis in the nation raised to 15,677 in 2012, and it started at 13,970 in 2011. This increase was 12.1%. Now here I have a video of a good friend of mine, Allison Lindy. She is a registered nurse, and she's going to talk to you a little bit about transmission, prevention, treatment, and the symptoms of syphilis.
Alright, so syphilis is an STD. It can be transmitted 2 different ways. First way is with direct contact. This is known as a venereal disease then. It can also be a congenital disease, which is when the mom passes it to the baby through blood. Let's see. So symptoms usually are sores. You can be asymptomatic for months. Some people are asymptomatic for years. Symptoms would include ingrown hairs that looks like an ingrown hair, ulcers, and through 4 through stages, it becomes worse and worse. There are 3 different stages. You have your primary, your secondary, you have your latent, and your late phase. So primary and secondary phases is when you're going to see your ingrown hair, which will then go to an ulcer, pussy, it'll be pretty gross. And then you're going to go to your late and latent stages. When you hit your latent and late stages, this is where your symptoms will become asymptomatic and gone without treatment. 10 to 30 years later is when huge organ damage can be done. You lose muscle control. You have usually onset or early set of dementia. You can go blind. Just a lot of nerve damage can be done. So without treatment, syphilis can be a very serious thing. If you catch it in the secondary and primary stages, it is a penicillin injection that they use. So an IM injection, you put it in your thigh, up in your deltoid up here, and it's usually just a course of antibiotics. That is done. So you do that, you do your treatment, and you're considered clear by your doctor. However, when you go and get any blood work drawn, you will have a positive test result for syphilis because your body has already developed the antibodies that will stay in your blood forever. So you'll need a handwritten doctor note to explain that you are cleared and you have done your penicillin treatment. To prevent syphilis, the best way is abstinence. However, long-term monogamous relationships are the best way, and just making sure that you're getting checked all the time. And of course, always use a condom. That's syphilis.
So as you can tell, syphilis is a very serious infection, and like she said, using a condom is very important. Monogamous relationships, and I mean, if you get it treated right away, that's the best thing. So some more interesting facts on syphilis from my gynecologist. Her name is Dr. Votel, and here is what she had to say.
Syphilis can be a devastating disease, and even though it's not the most common sexually transmitted infection these days, it was at one time. In its early stages, it's asymptomatic. People don't even know they have it because it starts with a painless ulcer that they may think is something else and mistake it for something else. If it gets into its secondary or tertiary stages, it can be much more devastating health-wise or even fatal to someone. So picking up syphilis in its early stages is of utmost importance when it's curable.
So as you can see, syphilis is not an STD to think lightly about. Definitely take action. Here are a few images, or a couple images here, of what syphilis can look like, where it can be, and how serious it can be. Here are a couple more images of the same thing. Again, it can get really ugly. And here are the references I used for my PSA. Thank you very much for listening.